My patient was a 78-year-old Caucasian male. He was brought to A2A from the ED with complications of an implanted penile prosthesis. He had surgery on March 12, 2021 for cystectomy, removal of infected inflatable penile prosthesis, possible suprapubic tube placement, but that didn't happen during the procedure. Some subjective data that I got from my patient in his room. He said, I felt like my whole body is a headache, and this was whenever I was doing my head-to-toe assessment. He also said when he was eating breakfast, I used to have an appetite, but I don't anymore. Some objective data I got from my patient was his potassium level was 3.9, white blood cells was 11.3, red blood cells were 3.59, hemoglobin was 10, hemocritic was 31.9, AST was 9, and ALT was 5. My initial findings: when I went into my patient's room, he was calm, cooperative with the nurses, doctors, and CNAs. He was very alert but oriented ×2. He was confused with his location and situation until we reoriented him where he was. I was in the room with the urologist seeing the wound area of the penile area. The wound had a lot of purulent drainage, and the doctor took out his 2 JP drainages from his surgery and then unpacked and packed the wound with gauze and ABD pads. The patient has a so-so appetite, only ate 50% of breakfast and lunch, and patient was in pain from his surgery. Some priority problems for my patient would be acute pain and impaired skin integrity. Patient needs: the patient will take pain medicine and antibiotics at scheduled time. Patient will maintain good hygiene. Patient will understand the need with wound care and how it will decrease infections. And patient will eat more than 50% of all of his meals. Intervention needs: the nurse will need to assess pain level of the patient. Nurse will monitor site of wound for color changes, redness, swelling, warmth, pain, or other signs of infection. The nurse will keep sterile technique with wound care. The nurse will evaluate the effectiveness of the medications. Everyone's emotions: the nurses were very busy and rushed through the floor because they were short-staffed. The nurses were very collaborative and helpful with us as nursing students. The nurses helped us whenever we were performing skills and answered our questions about the patients. The patients were very talkative but in pain, and we're happy we were there to help them. Some responses and changes to the plan. My patient was very willing, calm, and cooperative getting his medications after his head-to-toe assessment and breakfast. He was very willing and active to try and move himself in the bed, with my patient being alert but oriented to name, date of birth. I wanted to help him get more oriented with this situation and why he was in the hospital. Some skills performed: I did a head-to-toe assessment, assisted the urologist with a dressing change for the penile area, reapplied SCDs, snugger because they were too loose on the patient's legs and the monitor was alerting us. Used effective communication skills with patients, nurses, and classmates. Effective communication: the nurses were very effective with their communication when we had a concern about our patients. Helpful and informative with medications given to him. The nurses gave a good report at the beginning of shift for each patient. Differences in my plan at the hospital. From my shift today, the differences in the plan could have been communicating with my nurse better since she had a lot of patients. For my patient, I wish I could have had more interaction with him and talked to him more about his priority problems with his wound and pain level. So pros and cons for my skill performance. Pros: I had effective communication with the patient, did a full head-to-toe assessment, reapplied SCDs, and help patient get meal tray closer to him. Some cons: I wanted to have more patient interaction and give more patient education about his diagnosis and hygiene. Scenario performance. Overall, I thought my day in med-surg was very beneficial since it was my first time this week. I was very fascinated with my patient and helping out the urologist to addressing change and seeing the urologist remove the JP drains in the patient's room. And I had fun doing hands-on skills in clinical today.